Checking lumps. I check so many lumps all day long because dogs get little tiny fatty tumors or big fatty tumors. They grow into big fatty tumors. They get skin tumors that start under the skin and they turn into the bad mast cell tumors. And then they get other connective tissue and skin tumors that grow into little lumps that we have to check. If a lump grows rapidly in a short period of time or gets red or crusty, this could be a problem. So this little 14-year-old Yorkie came in, and let's take a look at the Yorkie. Look at how cute. His tongue doesn't even stay in. That happens sometimes when you're older, and I hope it doesn't happen to me. So she came in because he's got a little lump on this little leg, and you can see right down there, you can see that shiny little growth. Now, it's nice and red and shiny, and it grew fast. So those are things that we look for when we say, gosh, maybe we should investigate it, because even though he's 14, we don't want it to get really big and to start bleeding all over everything and to go into his body and cause a problem. So we want to check it out. So how do we check out a little lump like that? Well, we can put a little needle in it and we can suck out some cells, and then we put the cells on the microscope and we can look at them to see if it's a tumor that should be removed, or if it's just a glandular benign thing that if it didn't grow too fast or seem to cause any problems, it could be left there, especially at your age. I know he doesn't want to be here. So let's see if we can put a little needle into it. Wash my hands real good. Most veterinarians don't use gloves when they aspirate masses. So what we do is we put on the light there so you can all see, because I hate for you all to be in the dark. So see that little lump? A lot of people, and you got to make sure it's not a tick, and it's not a tick. So we actually put the needle right into the tumor, and then we suck out cells into the needle and into the hub. So we're sucking out cells. So then it's going to bleed a little bit, so we put a little alcohol on there to make sure it's okay and disinfect it. And then we take the cells that were in the needle and we spray them. Look at all that stuff that was in the needle. Isn't that cool? Those are hundreds and thousands of cells that we can look at to see what type of cells are in that little mass. And that's what we call an aspiration. Like many of you have aspirate to be a vet, aspire to be a vet. Well, forget that. Anyway, this is an aspiration, and then we dry this and we stain it and look at the cells, and that's what we'll do. So when you're in retrospect, though, and to close out this little session on lumps, if any of you have a dog with lumps, there is a lump called a mast cell tumor that can masquerade as anything, so it's always good to have it looked at. There's lumps that dogs can get that are fatty tumors, they're flat tumors that don't really grow very fast, they're under the skin and they feel soft. And if a tumor doesn't grow very fast and just stays soft, then sometimes it's okay. But again, it's always good to have any tumor check, especially when they grow rapidly. They get crusty, they get red, and seem like they're rotting or getting infected or growing rapidly, get them checked. Anyway, let's take a look at those cells and see what kind of cells we have in that tumor. So this is the stain slide under the microscope, or this isn't the stain slide under the microscope. So this is the slide that we stained, and you can see there's the splatter right there. And that even out of the little hub now, it shows that how many cells you can get out, or how much debris you can get out just by filling up the needle. You can see that there's some blood cells. These are red blood cells. They look like little frisbees. And they're all kind of just scattered around. And then in the middle of the red blood cells are all these dark cells with big old nuclei. And they're they're the ones that we're looking at that could be problems, because cancer cells have a great big nucleus and little cytoplasm, and we are looking for mast cell tumors, which have a lot of granules in them. It'd be a salt and pepper dotting, but we're not seeing those here. That doesn't mean these aren't mast cell tumors. You can have mast cell tumors without those granules. But anyway, that's what we're looking at when we do a cytology. We actually take a little bit of the cells, and let me just show you how many cells we have. Whoa! So you can just see we have. Let me go back. See, at least look at how many cells we have that come out of that little splatter. Now I'm just moving it around, just giving you an idea of. There's no cells. So there's some. Here's some more complex. Oh, those are nice red blood cells. See, look at that. They're squished though. The red blood cells, it's like having little water balloons pushed into each other, so it kind of elongates them. But those are pretty good circles of red blood cells. Yeah. Oh, and there's the tumor cells coming up. More. So that gives you an idea. Look at how big they are, how many there are. So we don't want those hanging around that little foot. We want to get rid of it. You can see how many there are throughout. Most of those too, they're tumor cells. They're not white blood cells or regular cells that are in the tissue, because those don't have those big old balloon type nucleus. I hope that gives you an idea of what we look for. So, a 14-year-old dog has got organs that aren't working as good as they did when it was younger. So we're going to take some blood, and we're going to check the blood in our machines in the lab, and see how the kidneys are working and how the liver's working. And where we get blood from dogs is in the jugular vein, especially the small ones. And it's not always easy, and they hate it, wouldn't you? So we're going to see if we can get a little blood and test the blood out. So you can see Kim's got the needle right in the jugular vein. She's drawing out a large amount so she can test it in the blood machine. And you can see our little guy he's starting to say, hey, that's not really what I had in mind, but anyway. And then she's putting it into little vials, then so the blood won't clot. And then we'll test it in the machine. And how are you doing now, Mr. Tongue? You get to go back out with Mom. I'm sorry we tortured you today. So if we check our little Yorkie's blood work, we can see that it's separated into sections. This is the section of the red blood cells and white blood cells. And it shows that we have enough blood cells to carry oxygen, and we're not anemic, and we have enough white blood cells to fight off infection, and we don't have too many that would mean there was an infection. They're a little low. That can be due to the white blood cells clumping, so we check it on a slide to make sure they're okay. But it looks like the other white blood cells are okay. Then the BUN is 46, it should be up to 27. That's kidney enzymes. And that means that during surgery, we'd use a drug that would not be harmful to the kidney, and also we would use some fluids during surgery in order to flush out the kidney so anesthetics don't accumulate in there. So of course we can see we're not diabetic, that's blood glucose. And then if we look down, this is the liver area, and one liver enzyme's a little bit high, but that's common in a lot of older dogs, so that's not really significant with everything else in the liver category looking good. And then these are electrolytes, sodium, potassium, chloride, and everything looks good in the electrolyte area. So what this means is that our little friend will go under anesthetic, put an IV catheter in, we'll run some fluids in during surgery, and after surgery make sure we flush out the kidney real good. We'll take out that little mass and we'll send it in for a biopsy if the owner wants us to make sure we got the whole thing off and it won't come back. Some people say, gosh, just get it off there and we'll watch it. And that's okay in this age of dog too, because you figure, what are you going to do? You're not going to go through all kinds of chemotherapy and radiation. You just hope you got the whole thing. Anyway, I hope that makes sense, and I hope you enjoyed learning about what the lab work means. So if your dog has a growth, remember that all growths can be dangerous. Mast cell tumors can impersonate almost anything. Most young dogs under the age of 2 can get a histiocytoma, which is a crusty round growth that usually goes away. Older large breed dogs and some smaller dogs can get fatty tumors they're kind of rounded soft tumors that grow under the skin. Harder tumors under the skin can be glandular tumors, lymph nodes, connective tissue tumors, and they all should be checked out. If any growth gains in size or grows rapidly, changes on the outside like it's red or black or crusty, get it checked out because growths can be dangerous. Your vet may be able to look at it, see it, feel it, talk with you about it and decide it's not dangerous, or they may want to put a needle in it like I did to make sure it's not that nasty tumor called a mast cell tumor or another type of connective tissue tumor. Anyway, well, have a good day. I hope you enjoyed the video, and check out Dog Dish Diet. We have a lot of people that are trying out home cooking, got more speaking engagements, and people are really liking how they can cook economical food that they know what's in it, because with all the recalls it's really important. So Dog Dish Diet's about if your dog has allergies, skin and ear problems, that's important to learn what foods you might buy to feed it and feed your pet to avoid the vet. Shows you how to use your crock pot to home cook for your dog and cat. Have a good one.